My name is John Whalen, and today I'll be presenting on a comparison of forecasted models and actual criminal filings of child abuse and related charges in Oklahoma during the COVID-19 pandemic. Child abuse is a grim reality, with over 3.5 million investigated cases and 678,000 victims identified in 2018. Child abuse includes physical abuse, sexual abuse, neglect, and exposure to intimate partner violence. Child abuse poses not only an immediate danger to the child, but has additionally been shown to have significantly elevated risk for morbidities later in life, including pulmonary disease, cardiovascular disease, depression, substance abuse, and suicide, among others. These outcomes are of tremendous strain for the individual as well as the health system as a whole. The risk factors for abuse are multifactorial and are a result of interactions between the child, caregiver, and the environment. Some well-documented risk factors include low socioeconomic status, alcohol and drug abuse, and high stress levels. The COVID-19 pandemic has disrupted many aspects of life, including school, community, and other forms of social support, such as church and daycare. The impact of COVID-19 has added to the risk of child abuse through financial and emotional stress, as well as increased caregiving demands. Additionally, social isolation has disrupted common routes of abuse reporting, as professionals provide a large majority of reports, the greatest contribution coming from educators. Therefore, our primary objective was to analyze the impact of COVID-19 and stay-at-home orders on child abuse and exposure to domestic violence as reported through the Oklahoma State Court Network. Our secondary objective was to analyze Google Trends to determine if COVID-19 had influenced queries related to child abuse. In order to analyze the effects of COVID-19 on court filings within Oklahoma, we collected data from the Oklahoma State Court Network database. Cases regarding child abuse and neglect from January 1, 2010 to June 30, 2020 were separated and categorized. Autoregressive Integrated Moving Averages, or ARIMA, was used to forecast criminal charges from February to June of 2020. The difference between the forecasted and actual data, as well as their confidence interval, was then calculated. Google data for the period between January 1, 2010 and June 30, 2020 was collected from Google Trends using the search terms child abuse and child protective services. Forecasted values for February to June of 2020 were similarly analyzed with ARIMA algorithms, and the differences in results was then calculated. Our results demonstrated a 25.7% average decrease in forecasted values from February to June of 2020. Each consecutive month had an overall number of cases less than what was forecasted and increasingly showed greater deviation from what was predicted, indicating a progressive downward trend. Likewise, June demonstrated the greatest deviation with 60.1% fewer cases than were forecasted for that month. The exception, however, was March, which approximated the forecasted values. The Google Trends data for the search terms child abuse and child protective services were within the 95% confidence interval of the forecasted values, and therefore not statistically significant. Our findings indicate that fewer reports of abuse and neglect towards children have been made since the beginning of the COVID-19 pandemic and are trending downward. It is unlikely that these findings represent falling cases of child abuse and neglect. Instead, it raises concerns that the effects of this pandemic may have disrupted conventional surveillance systems, leaving more victims of abuse without the means for intervention, which is further supported by evidence that risk for multiple forms of abuse have all increased as a result of stresses caused by the pandemic. Disruptive events such as the current COVID-19 pandemic present significant obstacles for both health and social services. Furthermore, public health interventions intended to mitigate the spread of the virus have effectively isolated children from adults outside the home who normally act as referral sources to child protective services when maltreatment is suspected. Because the study used criminal charges rather than reports of child abuse, there may be some lag before the full effects of the pandemic are realized. Additionally, stay-at-home orders were not as strict in Oklahoma as they were in other states, two limitations of the study. Nevertheless, as abusive situations develop and more cases are missed, the eventual results may be much more severe than if intervention had occurred earlier, even fatal. Although the systems of surveillance and intervention have been disrupted and fewer cases are being reported, there are still many forms of prevention and intervention that may yet be implemented. This pressing issue requires immediate action in order to lessen the damage already done and assist abused and neglected children in receiving the intervention and treatment they require.